Be out of the pandemic phase in this country.
Dr. Anthony Fauci has been one of the most consistent and trusted communicators in the U.S. throughout the pandemic.
People, and I don't know how.
And that is why the words he chose during an interview on PBS NewsHour triggered both hope and panic.
We are certainly right now in this country out of the pandemic phase.
Fauci later clarified he thinks the U.S. is out of the full-blown explosive pandemic phase. And then later he gave a rare clarification to his clarification, saying the pandemic is more controlled, but is by no means over. Bungled messaging aside, the numbers are headed in a better direction. The Centers for Disease Control says there are more than 11,000 COVID patients in hospital right now, down from the peak of nearly 160,000 this past January. On average, 330 Americans are dying from COVID every day, down from January 2021's peak, when the average passed more than 3,400 daily deaths.
So there's no question that we're in a moment, a different moment in our fight against COVID. But we also know COVID isn't over and the pandemic isn't over.
The White House tried to temper Fauci's initial message, appearing nervous his optimism could discourage Americans from getting boosters.
But we are still seeing people get very sick from COVID and cases of COVID, and we have measures that we should all continue to take to protect ourselves.
Nearly 60% of Americans have had COVID. Vice President Kamala Harris being the most recent high-profile diagnosis. She is working from home without symptoms, a new reality for many workers in this new pandemic phase. To have to make one clarification on such an important issue, that is significant. But to have to make two clarifications to get your messaging back on track, that's a difficult day for U.S. public health. Katie Simpson, CBC News, Washington.
Okay, now we've asked infectious diseases specialist Dr. Isaac Bogosh to join us because, Dr. Bogosh, I mean, Fauci's comments aside, what is your sense of the state of the pandemic in Canada?
We still have a lot of cases. We still have people getting sick. We still have people landing themselves in hospital and major disruptions to, for example, the healthcare sector and other sectors because people are sick and staying home. It's still very much here. Now, of course, it's significantly better than it was in prior waves. We have so much more immunity from vaccination, from recovery from infection, and it's definitely a lot different and a lot better compared to where it's been in the past. But in the same breath, of course, it still is impacting Canadian society significantly.
Right. So, I mean, I should get in trouble for asking you this, but are we even close then to being out of the pandemic phase? And what does that even look like?
We're wriggling our way through, but a lot of this really depends on who's defining what's a pandemic and what it means to be endemic. Regardless of where we're at, I think we can expect to see COVID-19 not go anywhere anytime soon. We'll see variants and waves continue to impact us here in Canada. That's going to happen for the foreseeable future. And with time, they'll just impact us less and less and less as we have greater community level protection through vaccination and recovery from infection and some combination of both.
Dr. Bogosh, always good to have you on the program. Thank you.
My pleasure.